October is a breast cancer awareness month, and there is already a lot of information about breast cancer. I have decided to take additional course and update you regarding all the changes in breast cancer screening, role of artificial intelligence, and 100% coverage of mammograms by all insurance mandated by law.
United States Preventive Services Task Force recommends every woman should have a breast cancer screening starting at the age of 40 up to the age of 74 every 2 years. You will find other organizations recommending yearly. Few of you may need to be done yearly if you are at higher risk, but for general public, that is where the evidence is. United States Preventive Task Force is not driven by specialty group or special interest group. They are a group of volunteer physicians. They collect all the evidence and then provide you evidence-based clinical guidelines. They do not recommend doing it more than every 2 years in general public. Second thing which is new in 2025 is that since September 2024, national dense breast notices will be sent to all women if you happen to have a dense breast. What that means? If you have a dense breast means your glandular portion of your breast and the fibrous portion, if it's more than the fat, that is considered dense breast. And that leads to hiding cancer at an early stage. If you happen to have a dense breast, that doesn't mean once you get a notice you need to panic. What that means is you may need 3D mammogram or MRI of the breast based on your risk. Take that notice to your provider and they will guide you through that. It is mandated that all insurances will cover breast cancer starting at up to 74 every 2 years. And you should not miss this life-saving screening. Remember, 1 in 8 women will develop breast cancer during their lifetime. It sounds very, very common. Artificial intelligence in breast cancer screening. I know there are two groups of people. Some hate artificial intelligence and they don't want to do anything with artificial intelligence, and the others embrace it. Whether we like it or not, artificial intelligence is proving to be life-changing in recognizing pattern much more sophisticatedly than individual human. Once trained on a data, they don't miss, they don't get tired, they don't get emotional. They are really life-changing. And now they are also becoming co-pilots and helping radiologists. It is estimated that radiologists' workload of reading mammogram can be decreased up to 50 to 55% with artificial intelligence. Breast cancer statistics. It is very common, as I said, 1 in 8 women will develop breast cancer. We diagnose about 300,000 new cases of breast cancer every year, and we lose about 50,000 women to breast cancer. Men are not immune to breast cancer. I know we get shocked. Men also have breast tissue. And if you have BRCA2 gene mutation, you are at high risk. We lose about 3,000 men to breast cancer every year. That is shocking. If your brother, uncle have breast cancer, don't ignore yourself. Get your genetic testing done. If you're positive for any kind of BRCA gene mutation, a man or a woman, do not panic. This just means you need to be careful, you need to be screened, and you need to be screened good. Now, shifting gears. These were the changes. United States Preventive Task Force guidelines, National Dense Breast Notices, artificial intelligence in reading mammograms, insurance coverage, and then statistics. Now, 15 of your most common questions. Question number 1. When should I start mammogram? We start mammogram at the age of 40. It goes up to the age of 74 every other year. There is no reason to do it in general public more than every 2 years. Next question. Do I need extra imaging if I have dense breast? Answer is yes or no. Dense breast doesn't mean that you are at high risk to develop cancer. Dense breast only means that your traditional 2D mammogram might not detect everything. So if you have dense breast, notice, most of the time your physician will recommend you to have 3D mammogram, because in 3D mammogram we can get better pictures and we could get better understanding of your breast tissue. Just imagine, in 2D image we are getting to know your breast in 2 views. It's like we are imaging the whole book. But once we do 3D images, can take multiple slices and your computer algorithm can build the pictures lot more precisely as if it's flipping the pages of the books. MRI can also be helpful. MRI is a very sensitive test and it can pick a lot of false positive results. Stick to the guidelines and wisdom of your primary care physician and your radiologist. I would say in 2025, if your center offers 3D imaging, opt for that. Next question, are 3D mammograms are better than 2D mammograms? Absolutely, I believe so. In your 2D mammogram, you're taking 2 images, like top to bottom and left side to the right side. You're looking at your breast tissue as a one block, like you're looking at a picture of a book. Whereas in 3D mammogram, while they are taking the mammogram, the tube is rotating or the device is moving to up to 60 degrees. So it takes multiple slices and it can check multiple angles. So it's like flipping the pages. Definitely it gets more images. Opt for 3D mammograms over 2D mammogram. What does my BI-RAD numbers mean? This is a very intelligent question. I think it was very beautiful when patients brought this thing. What that means? This is a system. BI-RAD stands for imaging radiology criteria, the way they kind of, when they're looking at your mammogram, they're putting into different buckets. If your radiologist looks at your breast images and he is not sure that it's a good picture, they will label it by red category 0, meaning it's not complete, you need to have more images. And that's where I get a lot of patients, they get nervous. Moment they think they need more pictures, they start thinking as if they have breast cancer. That is not true. That only means that you need more pictures. Then 1 means you're clear, 2 means benign, 3 is probably benign as you go along, 4 and 5, and 6 is the one when they take biopsy and they confirm that you have breast cancer. So 0, that you need to be tested more. 1 is the one which we are looking that is normal. Between 2 to 6, from benign to malignant, that is how we look at it. Next question, does breast pain means cancer? No, breast cancer does not mean cancer automatically. If you have a persistent localized pain which is not getting relieved and you are not lactating, you are not mensurating, it's not cyclical, you must not ignore and bring it to attention of your primary care physician, but it must be looked into. But every breast pain is not cancer. Next question, do deodorants and antiperspirants cause breast cancer? The question where I spend a lot of time researching is, most of the antiperspirants are aluminum based And if you are spraying near your breast tissue, it acts like estrogen and it can stimulate the receptor. Technically, it has never been proven in any randomized trial whether these deodorants lead to increased risk of breast cancer, but I want you to be aware that it acts like estrogen on the estrogen receptors. But till we have more research, it is safe to use antiperspirants. COVID does not affect your mammogram. I'm trans. Should I be screened? Breast cancer doesn't know your gender. It only knows the breast tissue. So you should talk to your provider and continue your routine screening. Do men get breast cancer? Absolutely. In 2024, there were 2,700 to 3,000 deaths which were reported due to male breast cancer. They usually have BRCA2 gene mutation, but if you have persistent red flag signs like persistent pain, lump, nipple discharge, blood from the nipple, or palpable lump, do not ignore the symptoms. Next question. Do GLP-1 like Ozempic and Mounjaro lead to breast cancer? They are only 3 to 5 year old medications. I don't believe we have enough data, but so far in research, there is no evidence of increased breast cancer. Next question. Does soy, seed oils, and toxin can cause breast cancer? Soy foods are generally considered safe. There is a lot of internet videos on that, especially on YouTube, TikTok, and Facebook and Instagram regarding vilifying soybean and soy product. But in scientifically studied, there has not been any increased risk of breast cancer. They use the common theory that the soy products can act like estrogen, and that is a true statement. But there are a ton of other things in our diet and food which act like that. Not everything will cause breast cancer. Are multiple cancer blood tests, MCED, are ready for prime time? Absolutely, they are not. This research of genetic marker is improving, and absolutely in near future that will be the goal. In 2025, at the time of recording of this podcast, that is not a standard of care. I do get here and there a lot of ladies who have joined some groups online and they have spent a lot of money and they will come with genetic markers, and we do not know what to do different other than your routine screening. Unfortunately, that group of women who opt for this kind of tests, they are really uptight, and it's very hard to make them understand where the evidence stands. How big is the risk with the hormone birth control pills? This is a topic in itself. Your birth control has two hormones in it. One is the estrogen and other is the progesterone. We have a lot of data. The birth control pills which have only progesterone, they definitely have increased risk of breast cancer and uterine cancer. For that, we have made a dedicated video. We will link it in the playlist. Please watch that video. What if I'm high risk? Do I need to have MRI? MRI is a very sensitive test, and I don't think in a very high risk people this will be a bad choice. But I would say stay with the guidelines. Opt for 3D mammogram over 2D mammogram, and if your primary care physician or your OBGYN guides you to get MRI, then you should do that. Because dynamics is you're at high risk. If your MRI picks up false positive, you will have unnecessary biopsies, and so it is prudent that you stick to the guidelines and do not change the normal routine screening. What happens if abnormal mammogram? First you need to understand does not mean automatically cancer, because as I said, BI-RAD classification will take in, and so you should complete the workup. Most of the time the mammogram, after you have the 3D mammogram or MRI or ultrasound, they will tell you whether you have cancer or not. But if you have a biopsy and you have a cancer, then you should follow oncology referral. Now we will take up, these were the 15 most common questions which has been asked to me by my patient and online groups. Now certain social media themes which was very disturbing. Number one was thermography. There are a lot of videos on YouTube, especially by the people who are not even doctors. Most of them are chiropractors. They do not practice evidence medicine. First was whether thermography is better than mammogram. And absolutely, thermography is not the standard of care. I know people are worried about the radiation, but the radiation is so small that it is even considered safer to have a mammogram during pregnancy. And why somebody who's not pregnant will go for a test which is not FDA cleared and it's not standard of care yet. Oh my God, there were so many questions on deodorant causing cancer, which I have explained to you. Also, this multiple tests for the cancer screening, they are not the standard of care. Artificial intelligence in reading mammogram, there was ton of data, and I could tell you that the artificial intelligence probably will be very integral part of our diagnostic armamentarium. There were so many questions on soy, which I have answered that. Alcohol definitely is linked to breast cancer, but that is excessive when people have led to their liver failure and they have liver cannot detoxify the hormones. Definitely it could be a risk factor. So now we have covered who should be screened, what are the myths, what are your important questions, what are the stand of different organizations. I think we should stand with the United States Preventive Task Force guidelines and do not sway from that. The concept of dense breast, your notices, and then BIRAD, taking it after your vaccines. If you stick to these guidelines, I truly believe you will have a beautiful journey with your breast cancer screening. Do not listen to myths and stick to United States Preventive Task Force guidelines. Look at CDC sites. We will link all the links in the descriptions so that you could individually click on them and get the evidence-based care. And then you will know the things for yourself. I hope this approach, answering your questions, busting some myths, looking at the social media questions, was helpful. We have a lot of videos on our channel regarding breast cancer. The journey which you go through after you get diagnosed with breast cancer. Go through those videos, like, share, and subscribe to our channel, Kundlas MD, and I will see you in one of those visits. A lot of people watch our videos, but they don't subscribe. Could you please subscribe to our channel, because we will send you notifications, and it also helps our channel to grow, because this is a work purely love of my life, where I get myself educated and pass the information to you guys. Thank you.